Nclex. It's a really difficult decision. I don't envy you, the board, on this decision, because there's part of me that wants to say, please let them continue, these 30 students to continue through their nursing school. And then there's a part of me that's concerned that we're setting them up to fail. So I don't envy you, and I do hope the school really steps up and it really does what they say they're going to do. We've been following this school for a long time. I know there's all new administration, and that is great to see, with some incredible dedication. But we've heard a lot of this before from previous administrators way back in the years. So I'll stop here, but I do kind of want to see these students come through, and then the school is going to have some harsh questions to answer if we've set these kids up to fail. Thanks.
Thank you, Catherine Hughes. Board President Trujillo, we have a request. I would like to type in a comment and have a board member read it, please. Her microphone's not working. How would you like to handle that one?
I can read it.
Okay. Go ahead and type in your request, and I'll move on to Rachel Plotkin.
Looks like she did. She looks like she typed it in. Yeah.
Okay. You want to go with that one, or you want to go with Miss Alamis?
I'll just go ahead and read it. She's done. It looks,
Okay.
it appears like she's done with it.
Okay.
This is from Evelyn Drinker. My comment is that ELAC should be provided all the assistance it can get, because valley fever is endemic to our state, and the latest issue of Scientific American has a cover story on fungal infections. Fungal infections are becoming an even worse threat, and our farm workers are especially prone to them. By extension, this threatens our food supply, particularly that of fresh fruits and vegetables, which are essential to everyone's health, no matter their socioeconomic status. Thank you. We can move on.
Thank you. Rachel Plotkin Alamis would like to talk. 1 second, please.
Hello, can you hear me? Hello, can you hear me?
Yes, go ahead.
Okay, thank you very much for allowing me to speak. I am a graduate of East LA, and I started the Alumni Association, and I have since become a full-time tenured faculty. I am very proud of East LA, and I'm proud of our alumni, and I'm proud of the service that we provide to the community. When I mentioned to our alumni board what was happening, I have so many letters that I can furnish you on what our alumni have said, how the program has made a difference in their life and in the community, and how they've gone on to teach at other places, be in charge of hospitals. We have a long, I don't want to get emotional, but basically it takes 2 years to change a program. And I've been involved with this program a number of years, and we just implemented the new curriculum that was asked of us. We started it in the fall of 2020, in the middle of COVID, and we actually even got ATI to add to that, and it's like we just started it, and you're holding us accountable to previous pass rates, and I understand that. However, that was a curriculum that we're not doing now. And so 2 of the 3 people were recent graduates, and 1 of those people had graduated several years ago. So it's very hard when you have people drop in. I work with alumni that graduated yesterday or 10 years ago, whoever it is. A lot of the faculty volunteer our time to help make sure that we can produce safe nurses. And our community partners have also demonstrated a great loyalty and dedication to ensure that happens. And I hope that you will continue our program, and you will see within 2 years, our pass rates will be fine. And I would stake my reputation on it. I think that our new criteria that we just started, before it was lottery system, now it's, multi-criteria system with a small lottery. This will help our pass rates as well, but that's going to take 2 more years to show a difference. Anyway, I appreciate the opportunity to make a comment. I hope that you will find it, that we can continue the program and continue our service to the greater community. Thank you.
Thank you, Ms. Olamise. Amanda would like to make a comment. 1 second, please. Go ahead, Amanda.
Good morning. My name is Amanda Caudillo Wilson. I'm very blessed to have been an alumni of ELAC. I graduated in 2006, and moving forward, I have stayed within my community in Monterey Park, East LA. I continue to work in Monterey Park. I have had the honor of working with the many students with the pandemic.
I'm sorry, Amanda, you're breaking up.
Can you hear me?
There you go.
Okay. Sorry about that. I've been working with the maternal students.
No, Amanda, we're losing you again.
Okay, may I just type it? Hello? Hello?
Board President Trujillo?
Hello?
We can hear you.
Oh, okay.
Hi, Amanda.
Sorry about that. Hi. And being able to work with the ELAC nursing students.
No, it's not working. Type it.
I'm sorry. We could hear her ask if we could hear her. Dolores, do you want to read this one in, or have moderator read it in?
I don't see that she's typed it yet.
Well, she hasn't.
Yeah,
I think.
sure.
Okay. Amanda, if you would just please write out your comment. While we wait for that, I guess, moderator, are there any other comments?
No, there are no others. I'm just waiting for it to post.
Sure.
Maybe we can take this last comment while Amanda is typing.
Okay. And Angelica Milan would like to speak.
Yes,
Go
thank
ahead,
you.
Angelica. Go ahead.
Thank you. Yes, my name is Angelica Millan, and I'm a past president of the National Association of Hispanic Nurses, and currently on the National Association of Hispanic Nurses local board for Los Angeles chapter. And I was also just part of the committee for the Future of Nursing 2020-2030. And what I would like to add is that in our report that just came out, it continues to state that we need a more diverse nurses. We need more nurses out in our communities to help us address our health inequities. And we know that nurses that are taught, that are raised within our community, stay within our community. And this is why I believe that East LA College needs to stay in existence. And also, I'm sure you know the stats, Hispanics, even though we're large numbers, I think the national is 19% of the population are Hispanic, yet nurses only represent, Hispanic nurses only continue to represent 7.5. And that is not helpful. That is not gonna help us move our communities forward. because we know that East LA College provides their whole student population are of diverse background, but East LA College is also a Hispanic serving college that we need to keep in place. And there's no way that we're going to be able to meet the future of nursing outcomes without the help of our community colleges. So that's what I would like to say is that I hope that we can continue enrolling our students that are much needed in our community. And as is part of NON, we would like to provide more support, more mentorship to make sure that our students are successful and that the program continues. Thank you.
Thank you, Ms. Milan. Would you like to go back to the
Yes.
Amanda? Okay, go ahead.
So I'll read the comment from Amanda. I have had the honor of working with the ELAC nursing students at Monterey Park Hospital. Once they have graduated, I have had the pleasure to work with them within the hospital, especially MCH. Diverse student population will help with decrease inequities.
Thank you. Brenda Chan would like to speak. 1 second, please. Go ahead, Ms. Chan.
Thank you, moderator, and thank you, board members, for giving me this opportunity. I just would like to make 2 quick comments. Earlier, when asked about the April to June pass rate, since we don't have the official number, I've reached out to our grads, and we have 10 or 11 students have taken boards for this quarter, April to June, and they have successfully passed. And we are waiting to hear more students to inform us because a lot of them are being delayed with the freeze process and receiving the ATT numbers. Another comment is regarding the Nclex pass rate. First quarter for last year, July to September, we have 14 takers and 9 passed. So the percentage was 64.29%. October to December quarter, we have 18 takers and 14 passed. So we have 77.78%. And then the January to March 2021 quarter, we have 3 takers, but 2 passed. So again, that 66% is not a true reflection of the course of the class. So I just would like to emphasize that. So another thing, if I can say it quickly, a pause should have taken last year, but all the faculty worked so hard in the summer on our own time to finish the curriculum. So a pause this fall would not be the most productive for the program and for the new students. Thank you for your consideration.
Thank you, Ms. Chan. Board President Trujillo, there are no other public requests for comment. Would you like me to close this window?
Thank you. You can close the window. Reja, Ray, is there?
Yeah. This is Reza. I assume you're going to ask about the closed session.
Yeah.
Right. Yeah, I've been looking at that. I don't think that that's something we can do.
Yes.
Because 1, it wasn't identified on the agenda as a closed session item. And 2, the reason that we didn't really consider giving you a closed session for this is that I don't see any authority in the Open Meeting Act for this specific type of discussion to take place in closed session. And the rule, of course, is unless there's explicit authority allowing you to do that in the Open Meeting Act, then you can't do a closed session. So, yeah, I think the rest of this discussion is going to have to continue in open session.
Okay. I would like to make, go ahead.
I
Go ahead, Mary.
I was quickly writing down the numbers that the last commenter gave about the numbers of students who had taken the Nclex and the pass rate. And if I did my math right, that would be 35 out of 45 in the year have passed. Was anyone else getting, and we could probably confer that. If 10 out of 10 really passed in the quarter that we're in now, that would mean that they were now at a 77.7% pass rate, which is, I mean, I think that's important to know. And are you going to make a motion, Dolores?
Yes, I was, unless there's any other comments or questions. Okay. I'm going to try to phrase this as best as I could. I would like to make a motion that we
Allow us to continue.
I would like to make a motion in light of this new information that I would like to give them opportunity to put their curriculum into action. You've got students that are already planning on entering this program with the stipulation that pending outcome of current graduates and Nclex passing scores, that we look at that in the fall, and possibly if they're not back up and this curriculum change is not productive for the students, that we suspend the spring enrollment. So we give them opportunity, and I realize that they've been on warning status. Our own staff, in meeting with them, I believe when Lori met with them, and Marianne, were you also at that meeting? That I heard, and I could have heard wrong, that it would take almost 2 years for any change to take place.
Yes, that is true in the curriculum. The problem is not, from my perspective, the problem is not the pass rates. We don't expect the pass rates to be up this soon. It is going to take 2 years. The problem that was brought forward in May was additional things. What Lori mentioned about the lack of resources, meaning losing staff and faculty on overload. The question about the implementation of the curriculum, because there's no evidence for me right now that shows that the curriculum that was approved by the board in June of 2020 is actually being implemented. And so they're working on that right now, giving me information about that. The faculty, a staff member, people on overload, and the loss of another program director. So in this year, we would have had three program directors since they came on warning status in 2019. So it's not, from my perspective, and Lori can jump in because she was part of the meetings, as you said, it's not about the Nclex pass rates. Well, it is. I mean, that's the bottom line as far as regulation, but that is not, there was no expectation on my part that their Nclex pass rates would be above 75 right now. My expectation is that when the curriculum was approved in 2020, in June of 2020 by the board, that the administration at the college had done their work for the first year, from 19 to 20. There was a lot of things that needed to be fixed. There was a lot of, which they did. It's put in resources, they hired, they did a bunch of stuff to put in place. They've had 2 consultants. And then in June of 2020, it now came to the program level where the faculty needed to implement. But again, there's been some change in the stability, and that's what came up in May, is the stability, the implementation of the curriculum. And somebody mentioned that there should have been a pause last year. That was discussed extensively between myself and the nursing program and the administration. The choice was not made to do that, and that's okay. I mean, that was the choice. But nothing as of May, when I brought my report to the board, we were back to where we were in June of 2020, in my opinion.
I'm sorry. President Trujillo, this is President Ramon. May I make one comment, please?
Sure.
Of course, go ahead.
Yeah, thank you. You know, I appreciate Dr. McCarthy's, and it's accurate in terms of how it's been described. Let me just share again what was part of the conversation today. One is that we did say and noted this on our presentation that by June 30th, you will receive evidence. And all the faculty have put this together in terms of how our syllabi is aligned to the content of the curriculum to make sure that we show evidence to you that the curriculum is in fact being followed. That's one. Two, that we have committed a full summer of curriculum review, which was part of my presentation, and we've resourced that, and we will make sure that that happens over the summer to be ready to go for fall. Three, that we have, in fact, I've committed an additional faculty position to the campus above what was needed to make sure that nobody's on overloads. And we'll have the conversation with Dr. McCarthy along those lines to give her full confidence that we don't have our faculty on overload, but that we do in fact have sufficient staff to be able to handle our ratios. The approval of the faculty position came in the last day or so, so I do know Dr. McCarthy did not get this information in advance of today's meeting, but I wanted to include it in the presentation to make sure that the board knows that this is happening, as well as the appointment of the consultant that happened late last night. So we are working towards making sure that we have the infrastructure in place. The curriculum was adopted in fall of 20. So this is, in fact, the first 2 semesters that we've had it. We continue to commit to it going forward. We have a different way of accepting students, which will ensure that the students that are being accepted have the ability to be successful in the program. And again, I don't want to belabor the issue, but I want to make sure that those comments were made to show that in the time that we have been working on this from May, there have been significant changes put in place and plans to make sure we address the board's concerns. Thank you again.
So Dolores, did you want to restate the motion? My understanding was that it was to continue to not have a pause in enrollment for this semester and continue the progress reports to board and committee as in the past. And then that would be the entire motion. Is that correct?
Well, they would continue on warning status.
Yes. So the warning status was not changed. So this one here is on the agenda is just for the pause enrollment. So we would not pause enrollment for fall, and we would continue to require progress reports to ELC and board, correct? Or was there
Correct.
more?
No. But we also need to continue the reports, and based on those reports, decide as a board whether to suspend.
Yes. Each time that you have an agenda item on ELC and board, the next ELC meeting is in a week-ish. So you could at that point recommend deferring action or doing an enrollment, whatever you wanted to do in a week. That would go to the full board in August. If you just accepted the progress report in a week, that's totally fine as well. And then in August, the regular agenda that was used in the May meeting will be on the August meeting, and any motion that the board chooses to take in August would be available. And then the next board meeting would be in November. And so that would be another option that the board could make any decision, and that doesn't have to be included in this motion. That's just our normal process. So for my board staff clarification, and if Dolores, you can repeat it as a board member, the motion was to continue enrollment and with progress reports to ELC and board.
Now we have a meeting coming up on the 24th.
We have committee meetings coming up. Yes, that is correct. The next committee meeting is scheduled for June 24th.
Can a portion of that be dedicated to the board in this decision? Pending the reports coming out in a week. I don't know.
The
if we have
agenda,
time.
so the agenda's already been posted. It does require a 10-day posting period per Bagley Keene. And ELC, ELAC, sorry, is part of the agenda for the ELC committee. So another discussion can occur. It is not a closed session discussion. It is open session, just as it is right now. However, the ELC committee only makes recommendations to the board. It is not a board meeting. The next board meeting is not scheduled until August. And that is when, if we wanted to have a closed session and it met the requirements in Bagley Keene, we could agendaize that to occur then. But that would be up to Reza whether or not there's something that could be in closed session. The rules are very, very strict with that.
Yeah. I think August might be too late because we've got students who are maybe planning to enroll in the program by fall.
The August would actually, July or August, which we do not have a board meeting scheduled for July, we do have one for August, would be the soonest that we would have the Nclex results. The Nclex results for Q4 does not end until June 30th, which would be 6 days after this committee meeting. And then those Nclex reports go out to the schools to be verified for accuracy, and then they're finalized. So we don't typically finalize the Nclex pass rates until about August. So the August board meeting, if we're looking for the Q4 pass rates for the annual pass rate, would be appropriate.
Hi, this is Imelda. I just have a comment.
Sure.
I think that we should probably put it off till August. I think, without fairness, we made a decision at the May meeting, and we're kind of discrediting those individuals, how they voted. Two of the board members that voted are not with us today. So I think to take a decision today, I don't think it's right. I think we need to honor our decision. And again, if we need to move forward, we can revisit this in August when we'll have more better data. You know, they've been in warning status again since I've been here. We've been working with ELAC for 6-7 years. It takes maybe 2 years. Again, we have to look and see what the passing grades are to continue, whether they're going to either be paused or continue to be on warning status. Again, I remember they've been on warning status for a very, very long time, so they've had many, many opportunities. I understand that this is a new faculty, new administration. That's great. I would love to continue working with them, but for now, I think we should postpone it or not make a decision today, and let's hear what they have to say in August or what the results will be. Thank you.
Imelda, I agree.
I was just gonna, this is Reza.
So Reza.
Just a real brief point. Imelda made a point about the board members who voted at the last May meeting and are not here today. That's certainly a fair point for you all to consider and keep in mind. I just wanted to mention legally, procedurally, that's not prohibitive of any action you know, potentially take today. So long as we have a quorum today, it's not really, you know, again, the point still is valid, but legally and procedurally, there's no problem taking an action that reverses the last action or you know, goes in any kind of different direction.
Thank you, Reza.
If I'm not mistaken.
My motion from the table. What were you going to say, Reza?
Moot point now. I was just going to say that I believe we have a first and no second.
Yeah. Yeah. So I'm going to withdraw my motion from the table.
Oh, God.
So
I'd like to make a motion that we do not change our decision and wait to reconsider in August.
That would be deferring action. Is that correct? Is that correct?
Yes, whatever terminology, yes, to defer.
I will second your motion, Mary.
So to be clear, that would leave in place the pause for fall 2021.
Yes.
Okay, we have a motion on the table from Mary and a second from Imelda. Let's take this to a vote. Dolores Trujillo votes yes. Imelda,
Imelda votes yes.
Jovita,
The votes yes.
Mary,
Mary votes yes.
Susan.
Susan Adams votes yes.
Okay, motion carries. Thank you. This was a very difficult decision.
Jovita says yes to very difficult.
I agree too, and I think, I speak for myself, but I can imagine the rest of the board members, no, we want this program to be successful. And I appreciate the work that's gone in. I believe what you're doing is the right thing, but you have a new director who hasn't even been appointed yet, who's going to be coming in August. And so I think to support going forward without more information right now isn't in the best interest. So, thank you.
Thank you, Mary. Okay. Moving on in the agenda, item 5.0, Board Strategic Planning moderated by Department of Consumer Affairs, DCA Solid Team. Do you want me to read the whole outline here of the agenda, or do we have somebody that's from the team?
We have somebody from OIO that will be presenting this.
All right, thank you.
All right, this is Tricia St. Clair with Solid Planning. And as we will need a moment to load our material, so I think this is a good time to take a bio break of 15 minutes. So if we can have you back with us by 10:45 a.m., that would be wonderful. So I will go ahead and be working on loading our materials, and if you can please be back by 10:45 a.m. and just make sure your mics are muted, and you can turn off your cameras as well if you like. Thank you.
Thank you. See everyone back at 10:40. I guess you could just say if you're present.
I'm here. Present.
Thank you. Jovita?
Jovita Dominguez, appointed by Newsom as an educator.
Thank you, Jovita. Mary?
Mary Fagan, I'm here.
Susan? All right, we have a quorum.
Great. Thank you so
Tricia.
much. Thank you, Madam President. All right. So as I've said, my name is Tricia St. Clair, and I am a strategic business analyst and facilitator with Solid Planning. I am here with my co-facilitator. I'll let her introduce herself.
Thank you, Elizabeth Coronel.
All right, so our roles today, we do not work for the Board of Registered Nursing. We do not represent the licensees. We are a neutral party. We provide structure to the strategic planning process. So we gather the data, we organize it, provide it, and then we facilitate the strategic planning process, after which we come up with a draft for a strategic plan that the board eventually approves. You will see us documenting your discussion today, so I apologize in advance for my typing. You will see us typing today. And we like to have a reminder that we will correct spelling and grammar later. We've had some participants in the past get so involved with finding grammatical errors or typos that they kind of forget the purpose of the workshop itself. So just throwing that out there. We really hope to have your full participation today. So if you can minimize distractions, we understand a lot of us are at home, so we might have children, we might have noisy pets. So if you could just do your best to minimize distractions, that would be wonderful. We hope that you respect everyone's contributions. We want people feeling comfortable making contributions today. If you could suspend judgment during brainstorming, we hope that people can get creative, and we've got legal counsel here to rein us in if we step outside the mandate. Also, if you could self-monitor for time limits and side conversations. We have 7 goal areas to get through today, which is not impossible, but it is a big chunk. And then if you could just be willing to reach consensus. So some of the objectives that we come up with, you may not be totally happy with, but just if you can ask yourself, can I live with this? So our agenda, we've already done a part of it. We've done our introductions. I will be going over what strategic planning is, just a quick overview. We will revisit the board's mission, vision, and values. We will look at the goal statements. So for each goal area, there's a statement defining it, and you'll have that to read before brainstorming. And then the big purpose for our meeting today is to brainstorm objectives for the board's 7 goal areas: licensing enforcement, continuing education, educational oversight, laws and regulations, organizational development, and outreach. So if you are looking at a directory, what is the most important thing to find? And you can just unmute yourself and let me know, or you can raise your hand. So if you're looking at a directory, what's the most important thing to find?
I'd say what you're looking for.
That is a very good response. I know when I was asked this question as a Girl Scout, I said the restrooms, and that was not the correct response. It's actually where you are. So when you're looking at a directory, the very most important thing to find, first of all, is where you are, because that's going to determine how you get to where you're going. Just like if I were going to Los Angeles, my trip planning would be a lot different starting from Sacramento as opposed to Riverside. So your mission statement is where you're starting from. That's your purpose, why you exist. And your vision statement is your destination. It's what you're headed to. The environmental analysis is exactly what it says. It's your work environment as well as environment outside your board. And that environmental analysis that we put together for this session today is like your traveling tips. So to help you reach your destination. So we also have, to help us get there, we have the goals, which is your board's day-to-day operations, such as licensing and enforcement, and the objectives, what you hope to accomplish within each of those goal areas. So to bring home the importance of strategic planning, I'm going to ask you to play a game with me. And I will, when I say go, I'm going to have you touch the screen, or if you don't want to leave fingerprints on your monitor, you can use the tip of a capped pen or a pencil eraser or a stylus. But I'm going to show you numbers. And when I show you numbers and I say go, I want you to type the numbers consecutively. So find the number 1, then the number 2, then the number 3. All right. So when I say go, I want you to type these numbers consecutively, and I'll let you know when the time is up. So you can go. All right, time is up. So was anybody able to get to 20?
No, this is
No?
Dolores.
Okay. All right, anyone else? Did anyone else get to 20? How about 15? Did anyone get to 15?
I got to 18. This is
Okay.
Lori.
18? Do we have anyone else that got higher than 18?
I got, I think, the lowest score.
That's okay. You don't have to tell us. Okay.
I think I'm right behind you.
All right. Okay, so what if I told you there's a strategy to this game? There's actually a pattern to follow. So
Oh my goodness.
the 1 is in the 1 quadrant, the 2 in the 2, the 3 in the 3. And so you just follow this pattern, touching the number. So I'm going to have you play this game a second time. So when I say go, I want you to touch the numbers consecutively, only now you have a pattern to follow. Okay, so now go. All right, time's up. So now did anyone get to 20?
Yes,
Yes.
I did.
Okay.
Yes.
Much easier.
Okay, and did anyone, let's say, did anyone get to 40?
Yes.
Okay. Did anyone get to 50?
Yeah.
So, all right, did anyone get to 54?
I got to 54 and had time.
Oh,
Wow.
all right. Excellent. So the point of this game is to show that when you have a strategy, you can accomplish a lot more. Sure, you can do something if you don't have a strategy, but if you have a strategic plan, you can use your time and resources more effectively. And that's the point of strategic planning. We want you to use the board's time and resources in the most effective way possible. So this is the flow chart of the strategic planning process, and the arrow is pointing to where we are today. So we're in the planning session, and as you can see, after this planning session, the next steps are we will draft a strategic plan based on the content you come up with today. The board will, staff will have input as far as if they want edits made. Then your board will have the chance to vote on it, approve it. Once the strategic plan is approved, it gets posted on your website. And then the next step is action planning. Without action planning, it's just words on paper. So action planning is where we take your strategic plan, meet with staff, and then they break each objective down into steps, assign those steps to staff with target dates, and then assign a success measure to it. So that's the whole process. And I mentioned the environmental scan earlier. Again, it's literally a look at the workplace environment as well as the environment outside the board. And so what we did is we did a SWOT analysis, which is just a fancy way, acronym standing for strengths, weaknesses, opportunities, and threats. We asked stakeholders, committee members, staff, executive staff, and board members to what are the board's strengths? What does it do well? So an example of that would be maintaining high standards. And then weaknesses are things that the board could improve upon. And so an example of that would be perhaps accessibility. Maybe it's really difficult to get in touch with a live person. So strengths and weaknesses are internal. They're the board's part of the board's work environment. And then opportunities and threats are the outside environment. So So what's going on in the world? So that could be the economy, politics, education, technology, anything happening in the real world that your stakeholders feel your strategic plan should address or capitalize on. So an example of an opportunity you might want to capitalize on is technology, that the pandemic has forced a lot of people to turn towards technology, and maybe that's something to capitalize on. A threat is something that you will want to mitigate that's happening in the outside world. An example of a threat could be how the pandemic has affected licensees, just addressing that. So the environmental scan is highlighting what your stakeholders feel are the priorities that your new strategic plan should address. And that's why we do strategic planning every 2 to 4 years, because the world changes and we want to make sure that your priorities are focusing on what's most important. So here's an example of your responses to your 2017 environmental scan as opposed to the 2021 environmental scan. And as you can see, the participation rate amongst your licensees more than doubled this time, which is why your environmental scan is 628 pages, because you had so many people participate this time. So you have a lot of good solid data to work with. And I explained how the mission statement is where you start from. I want to give you a moment to review your mission statement. And if you decide that you would like to see this edited in any way, just let me know and we can discuss that. So I'll just give you a moment. And then let me go ahead and all right. So does anyone, are we good with this mission statement, or does anyone want to change it in any way?
This is Reza, the board's legal counsel. There was an issue raised by the legislature during our recent sunset review about our mission statement. I think it is important to look at revising it. The issue that was raised had to do with the phrase, the highest quality of registered nurses in the state of California. I'm working on, let me see if I can an exact wording of the legislature's, that might take a minute, but the gist of it was that that mission statement referring to the highest quality of registered nurses, certainly I think by most kind of intuitive standards that makes sense. It's kind of, it looks like a reasonable mission statement. However, the point that the legislature made was that as a regulatory board, our objective ought to be more to ensure minimum competence and not necessarily the highest quality of registered nurses. I think that, again, seeing those types of phrases, highest quality, best, this and that, those kind of hyperbolic statements, very standard in mission statements of, most organizations like companies and other types of entities. However, as a regulatory board, I get where the authors of this mission statement may have been coming from, but I think the legislature made a potentially valid point. Again, that point was that, on a scale of 0 to 100, 0 being the worst possible nurses ever, 100 being perfect, it would be great to be at 100, but us as the Board of Registered Nursing, it's not our mission necessarily to ensure that every single nurse is at 100. We have to grant licenses to nurses who establish what we think is a reasonable minimum level of competency. So they took issue with that phrase, the highest quality of registered nurses. So I'll leave it there. Meanwhile, I'm going to look and see if I can find the exact wording of the of the
Okay, so
legislature's critique
right.
there.
Thank you very much, Reza. So maybe something to consider if you remove highest, it could read the California Board of Registered Nursing protects and advocates for the health and safety of the public by ensuring quality registered nurses in the state of California.
Or what if we just say something like, through the fair and, consistent application of statutes and regulations that govern nursing practice and education?
Okay.
Because I think that's what we do or are supposed to do, right? It gives a
Okay.
little more meat to what I glanced at some other Board of Nursing
Okay.
mission statements, and there's sort of a consistent approach using that verbiage.
Okay. So Mary, you said that so well. Let me go ahead and get that typed in here. So I'm sorry if I can ask you to please repeat what you just said, if you don't mind.
Yeah. It could be, let's see. Protect the health, safety, and welfare of citizens of California
Okay.
by the fair and consistent application of the statutes and regulations that govern the practice of nursing and nursing education, or something like that.
Okay, so protect the health, safety, and there's one more thing.
Health, safety. I can't remember what we said. Health, safety,
Well-being.
welfare. Maybe, welfare, well-being.
Okay.
Yeah.
Of consumers, of Californians.
Our citizens of California, maybe.
I might just, rather than citizens of California, use a different phrase like public or consumers or something.
Okay.
I mean, it's a super minor thing, but technically, whether you're a citizen in California or you're just visiting, you're still part of the public that we aim to protect.
Yeah, I like that, Reza.
Yeah, that's a good point.
All right, so we've got protect the health, safety, and well-being of the public.
Of California.
By the way, I want to wait until this is formulated, but I did find the language that I'd like to read from the legislature after when we're ready.
Okay. Okay, thank you, Reza. All right, so you've got protect the health, safety, and well-being of the public of California.
Through the fair and consistent application of statutes and regulations.
And actually, I'm going to go ahead and put this on the slide by itself. Let me unhide this one. So we have a little bit more room here.
Of statutes and regulations governing nursing practice and education, right?
Do we want to add that, or?
I think that, because those are the statutes and regulations where we have purview over, right?
I think it was governing nursing practice and education, and that is very slight kind of, but I think significant effect of that.
All right, thank you.
Is it too much into the woods or the reeds to say something about the Nurse Practice Act?
This is Reza. For my part, I think that's fine if you want to say that. You could leave it as is, or you could say fair and consistent application of the Nursing Practice Act and corresponding regulations. Technically, this is again a very slight kind of issue, but and leave it to me to kind of get hung up on little things like this. But technically, there are statutes outside of the Nursing Practice Act that we enforce, and those are primarily in the general provisions of the Business and Professions Code and in the general provisions of Division 2 of the BNP Code relating to healing arts. The Nursing Practice Act is specifically the BRN's statutes. And
that's one of the statutes, right? So it would be included in statutes and
Sure.
regulations?
Yeah.
Correct. Yeah.
So we can take it out. And then Reza, can you read to us what you were looking for regarding the, thank you.
Okay, so the legislature, and you all saw this, this is from the background paper for the Board of Registered Nursing, which was drafted by staff of the legislative committee that did our sunset review. In case anyone wants to look it up later, that's on, I'm looking at page 22 of that document. So it says, issue number 3, licensing versus promotion of the profession. The longstanding policy of the committees that the purpose of licensing is to protect consumers through the least restrictive means, not to guarantee the highest quality practitioners, period. Are the BRN's missions and actions consistent with this policy? That phrase I just read was the issue. There's several paragraphs of discussion in there, and then the staff recommendation from the legislative committee was that the BRN should discuss why its primary mission is to protect the public by ensuring the highest quality of RNs rather than to protect the public through the objective regulation of the profession. And again, I think that despite what our mission statement said, I think in practice, during the time that we've had that mission statement, I think just from what I've observed, this is my own observation, I've seen kind of more actions more consistent with kind of what the legislature had in mind here with least restrictive means of regulation, but ensuring consumer protection. But I think that the revision that where we're at right now, certainly welcome to tweak it more and all that, but I think it's a step in the right direction to kind of address this issue. And not just a step in the direction, I think it's resolved the issue. Of course, you can continue to hone it or whatever you want to do.
Okay.
Did you want anything else from that legislative report, Dolores, or anyone else?
I'm okay for now, but yeah, I'm okay for now. We'll see as we go along.
Okay. So how do we feel about the mission statement that's showing right now? Does it look good? Do we want to workshop it a little more?
I think, can we maybe incorporate some of the previous mission statement in this?
Let me go back and I will get that strike through out of there.
I think what Mary contributed is good.
Okay.
I think there may be a part of the previous, our current mission statement that we can also keep.
All right. So this is your current one that I've highlighted.
California Board of Registered Nurses. Maybe the first part, California Board of Registered Nursing, and then add this protects.
Or should
anybody else can chime in.
How about is the California? I mean, a lot of mission statements start with 2, don't they? The mission is 2.
Yes, sometimes they do, like, so be to protect the health, and yeah. We can try it this way too.
And I guess that's basically the same thing. We just say the California Board of Nursing. Our mission is to protect.
I feel like it's a little open-ended at the end.
Okay.
Mary, thoughts on how to close it, or do you think it's open-ended?
Fair and consistent application of the statutes and regulations governing nursing practice and education. I mean, how would you suggest?
Okay.
I mean, that captures it to me, but I could totally support some edits if anybody has any other thoughts. I think from my perspective, I think being concise, the more concise we can be, the better.
Sure. Do we need to say at the end, maybe in the state of California?
Well, we've already said the Republic of California.
Yeah, it's redundant. Thoughts, anyone else?
You could, if you wanted to, well-being of, so you could say the California Board of Registered Nursing protects the health, safety, and well-being of the public through the fair and consistent application of the statutes and regulations governing nursing practice and education in California.
In the state. You got it right. Yeah.
Okay. So, Tricia, you'd be striking the phrase of California and then just adding at the end in California.
All right.
This is Imelda. Why do we have to say the California board? Why don't we just strike California since we're saying it at the end?
So just have it say the Board of Registered Nursing?
I think so. I mean, I think. Ideas.
In the state of California, or we just leave it at California?
Either way.
Okay.
I like that.
So is this middle one our winner?
I like that one.
Yeah, I vote for that one also.
Okay, great. Go ahead and get rid of that. Okay. Fantastic. So our next thing to look at is your vision statement. This is your destination. So if your board achieved its mission, this is what would result. And I'll give you a minute to look at this, and then you can let me know if you want to revise it.
Would we strike out the high quality also from here to be consistent with the previous one?
This is Reza. So, country's premier board of nursing. I think so. A couple things on that. First of all, the vision statement wasn't specifically brought up by the legislature. Nevertheless, I think it is a good point to consider, Jovita, just to make sure we're consistent. But the issue with the mission statement, the previous one, was that it said highest quality and not just high quality. I think there's, it's still a valid point and worth considering, but there's obviously a significant difference between high quality and highest. And the legislature definitely had a problem with highest. Whether I don't know if they necessarily have a problem with high quality nursing education. The other thing, unrelated to that, I just wanted to make a comment. I'm not a board member, but I do have kind of strong feelings about this one. To me, every time I've read this, the word premier has always, and our description of ourselves as the premier board of nursing, whether we think that or not is a separate issue, but putting it down as our vision statement just seems a little bit.
Yeah, it's like we're above everybody. Yeah,
Right.
I agree. The premier needs to go away, and high quality, maybe competent nurses. I don't know.
Okay.
I don't know. I don't like the highest quality, maybe competent.
Okay, so let me just put the current one down there, and then we can.
I did the same thing and looked at a lot of other boards of nursing, at least a lot of them don't really have a vision statement, at least that I can find. And I didn't spend tons and tons of time on this, but I found a couple that I thought were interesting if people are, and because I do think it's reasonable to say, what else do other boards do? And is there something we would want to emulate? But there was one from Minnesota, and I can't remember the medium, or I think Ohio, and then Alabama, that I thought were interesting. You guys want to hear them and see if there's any of that stuff that we thought would be appropriate, or?
Sure, Mary, go ahead.
Okay. Minnesota said the Minnesota Board of Nursing will be a leader in effective nursing regulation by creating, administering, and sharing innovative regulatory practices. I like the idea of innovative and being a leader in effective nursing regulation. And then the one from, I think it was Ohio, sorry, their vision says we aspire to, with a semicolon, says deliver benchmark quality services in healthcare regulation, meet the challenges of a dynamic and ever-changing healthcare environment, have an organized environment that fosters an organizational environment that fosters creativity, innovation, and outstanding leadership, have a committed and appropriately compensated board and staff who have exceptional knowledge and skills, achieve integration of regulatory efforts affecting the health of the public, and have effective and efficient board functions. And then the last one, which is very short, the Alabama Board of Nursing strives to promote and safeguard the health of the public through regulatory excellence. So just some things to thought. I thought some of those, the middle one I think is probably a little too wordy, but any of those resonate with anyone, or some pieces of them?
Well, we can't guarantee competence.
What about saying that the regulatory excellence, we would aspire?
And this is the facilitator, Tricia. I just want to jump in and say, so the vision statement is your snapshot of a perfect future. So you're describing what would happen if you achieved your mission statement. And I'm just throwing that out there because a lot of times what boards will do is they'll create a second mission statement for their vision statement. So the vision statement is a picture of your perfect future. So.
Could we say we want to do something through regulatory excellence? We want to be excellent. Could that be something that we could aspire to? Protecting patients.
I like what I believe it was Mary that said something to aspire to.
That they had, that was one of the boards that had these statements. Let's see if I can find it. Yeah, and they aspired to it. Maybe is it Maryland?
The New York mission, very simple. The mission of the Board of Nursing is to safeguard life, health, and the public welfare of the people of this state, and to protect the people of the state from unauthorized, unqualified, and improper application of services by individuals in the practice of nursing. I would strike the last I would probably just to safeguard life, health, and the public welfare of the people of the state, and to protect the people of the state. Something short and simple.
That's more the mission as opposed to the vision, though, right? Because the vision is like our desired state.
Okay, yeah, you're right. You're right.
Yeah,
That's very.
but you could rewrite that though as if it has already happened. So you know that's what a vision statement is. You're describing that what you aspire to has already happened. So
I really like this one that says we strive. Okay. Will be a leader in effective nursing regulation by creating, administering, and sharing innovative regulatory practices. I like the idea of putting innovative in there. That would be a challenge to us.
You want to be challenged more?
I do personally. I think if we were a little, I mean, maybe some things that would be innovative might make it easier.
okay. So I started to type that. It sounded like a leader in effective nursing.
I mean, we could put that and see if people, an effective nursing regulation. And this is Minnesota. I want to take it word for word, but he spoke to me by creating, administering, and sharing innovative regulatory practices.
Innovative. Mm-hmm.
Some of my screen is missing. I'm sorry, I did miss some of that.
Let's see, a leader in effective nursing by creating, sharing, and administering, by creating, administering, and sharing innovative regulatory practices.
Okay.
I'm not sure what.
I'm not sure about innovative.
You know,
I mean, I realize as a board, there's just it's ambiguous and innovative. I think sticking to statutes and regulation is probably more definitive in what we should be looking at.
But I also think that we need to be sharing with our stakeholders. I mean, we often work with the schools.
But it's the word innovative.
Sharing. What do you want to say?
I don't know. I mean, that's just my thought right off the bat. So I don't know. I'm trying to think of what word.
Quality, high quality. Effective nursing, reliable, creating, administering, and sharing.
Collaborating, I don't know.
Collaborating, it's something along that lines would be good.
Partnering, collaborating, because we do work with, our stakeholders.
Yeah. But this, at least I think the part here is to try to get at how you do it, right? I'm like, it's collaborating, but what types of regulatory practices do we seek, to administer? Administering and sharing.
Can we take out innovative and see how it looks, please? Creating, administering, and probably collaborative. And sharing?
And sharing is what? And sharing effective administrative practices or effective regulatory practices, right? Isn't that what we're trying to say?
You have effective in the beginning, so you have a leader in effective nursing regulation.
Or we could take effective out and put a leader in
nursing regulation.
By yeah.
Okay.
Sharing effective regulatory practices, yeah, that would work.
Okay.
and sharing.
Okay.
Did we say sharing?
This is Reza. The sharing piece, I'm just having a hard time getting past that because, you know, our primary focus is ensuring quality access to care, equity, and all that kind of stuff. You know, sharing with other regulatory boards and things like that, that is certainly important. It's important to be collaborative and to help other boards and to also learn from other boards. Obviously, that's what we're doing here. But, you know, this is just my perspective and it's totally subjective, but I kind of question why, you know, on paper as our vision statement, you know, would we say that we want to share with other boards?
I wasn't thinking so much sharing with other boards as sharing with the public and sharing, you know, with our constituents. Like there's a lot of in here is like to, you know, make sure that we educate the public and especially nurses about the regulations. And so that's sort of direction I was going with that. But I don't think we could just say a leader in nursing regulation by creating and administering effective regulatory practices.
Do we need to say anything about our previous vision had protecting patient advocacy? Do we want to put anything like that in this one?
To protect.
Our previous.
Yeah, we don't protect patient advocates.
Okay. I just want to make sure we don't want to put anything like that in there. Do we want to say anything about patient advocacy?
To safeguard the health of the public through this? To safeguard. And that's the advocacy piece we're talking about, right?
Yeah, that would be good.
By the way, Tricia, I think administrative, Mary, correct me if I'm wrong, which should be regulatory.
Yes.
Okay.
Regulatory.
Thank you very much.
Safeguard the public. It doesn't sound particularly lofty to me, but given some of the feedback that we got from, I think to get here would be it. Typically, you want a mission statement to be a little more lofty, though, right?
It's true. You
But
typically
would be a leader. Yeah.
Yes.
Leader in
Yes.
nursing regulation.
So one thought that just kind of keeps popping into my head, you know, I think our kind of most obvious objective is to protect the public health, and we've got that in there. Another one that we've kind of talked about a lot recently with little issues popping up here and there, or maybe big issues, is to me equity in terms of access to care, access to educational opportunities, things like that. You know, the legislature has taken steps to try to promote equity and access to care across the state and things like that. So just a kind of a little thing I wanted to throw out there. If you're looking for more to kind of cram into this, we've already talked about public health. Maybe equity is a piece that you want to throw in there. Maybe not, but just.
I think that's
that's great.
Yeah, and very timely.
Yeah.
So would you want to say to safeguard equitable public health or?
I might, this is just one thought, and I'm thinking on the fly, so this might not be the best, but a leader in nursing regulation by creating and administering effective regulatory practices to safeguard public health and ensure equitable access to blank. And the blank is where I'm kind of stuck. I'm not sure. Obviously, we want equitable access to care, and that's why you know steps have been taken to you know allow independent practice, and you know we had the discussion earlier about you know keeping people in the community where they studied and where the need is and things like that. So, but obviously, equitable access to care, that's the piece that's obvious.
To care or health care, does it make a difference?
Well, I'm fine either way, but I think we can refine that. The piece that I'm not sure whether we want to throw it in there. I think technically it is part of our mission, but is the educational piece. So to kind of finish it, if you wanted to include that in there, you might say ensure equitable access to care and educational opportunities. Or maybe to ensure equitable access to care for consumers and to educational opportunities for aspiring nurses or something like that. I'm thinking on the fly, which is hard, but.
This is Jovita. How about like the word enhance, like educational opportunities to enhance care, or isn't the word enhance not worthy of the, I don't know, to me it's like educational opportunities give you a boost to improve your health, the way, you know, to either to improve your practice or refine it.
I think the idea of enhance is a good idea, but I'm not sure that it kind of fits where, given what this sentence is right now. We could rework it to get that in there, but right now that piece is talking about the equitable access to, schools, and not so much like.
But equitable access to education and care, equitable access to education and care. I mean, just to educational opportunities and care. Do we have to put consumers?
Sure, equitable access.
Equitable access to healthcare for consumers. That defines it a little better.
After reading it, I'm kind of questioning the for consumers piece.
Okay.
It just starts to get real wordy.
I don't think we need to say that.
Access to educational.
A leader of nursing regulation.
Do we want to add something to the educational opportunities?
The piece that I'm kind of still playing with on adding to educational opportunities is, again, I think it's understood what we're talking about. We're talking about nursing education, but as it is, it's, we don't deal with
Other
legal education. We don't deal with any other education. So that's where I was like trying to think of, okay, maybe we add for consumers to the healthcare piece and for aspiring nurses to the educational opportunities piece, just to clarify the education that we deal with, which is obvious and probably goes without saying, but it clarifies. So ensure equitable access to healthcare and.
Or what if we said, to safeguard public health and ensure nursing care is equitable and accessible to all? Would that capture both the?
Well, let's see that in writing. That sounds good, but let's see how it looks.
Okay.
No, not.
I was just gonna, so
Okay.
you can, yeah. So
Let's see, I got a leader in nursing regulation by creating and administering effective regulatory practices to safeguard public health and ensure nursing, so this is where the change would be after, ensure nursing care is equitable and accessible for all. Would that capture that?
I think it's missing the educational piece.
This is Reza for my part again, just my part. I like it. I could live with this one. I think it does leave out the educational piece. The piece that I was kind of most, in favor of adding was the equitable piece. And this has got that in there. So I could.
How about we have a leader in nursing education regulations? Can you put it up there somewhere?
Nursing care and education. Would that capture it?
oh, sorry.
maybe a leader in the regulation of nursing practice and education.
That would be good. I like that.
And education.
Education.
The only word in that now that still keeps sticking out to me is that by saying we want to administer effective regulatory practices, I always feel like a vision should be a little more aspirational than that. What would be another, more than effective, but perhaps not too lofty? Anybody else? Is anyone else bothered by that?
Yeah, I see what you mean.
Just take it out.
Or I'd rather put in some sort of a descriptor that was a little more.
Yeah.
How about excellent or outstanding?
This is rather, those are lofty terms. I was going, my mind was going in a different direction with it. This is not lofty, but replacing effective with sensible. Again, that's not lofty at all, but our regulations are not supposed to be, again, I kind of go back to the point from the last item, which was the legislature, made a point that we're trying to do kind of minimal, what was the term they used? Least restrictive licensing laws. And so to say that our licensing laws are sensible, to me, that kind of conveys they're sensible in that they effectively regulate, but also they are not overly restrictive.
How about this? What if we just leave sensible out and just hit administering regulatory practices that safeguard public health and ensure nursing care is equitable? And we don't have to get into, because sensible to me doesn't sound like something you'd want to have in your vision statement, but this way, is that captured without?
I agree.
That safeguard public health and ensure
nursing care is equitable and accessible for all.
ensure that, or do we need to put just ensure nursing care?
I think we just have that for a safeguard.
Okay.
Ensure nursing care is equitable. I like that.
Accessible for all.
Right. So are we
Did we decide to insert that between ensure and nursing? Or did we decide against that?
I don't.
Personally, I like it with that.
But I don't think it's necessary.
No, we can just leave it.
All right, so it sounds like we're good with what I've highlighted, the one that I've highlighted.
Do folks prefer it the way it is right now? Because it reads cleaner to me with the word that, but that may totally be me and only me.
My thesis advisor or dissertation advisor took every single that out of my dissertations.
You're scarred from that.
Every time I see a that, I'm like, I gotta get it out of there. So I could live with it either way.
I think it's fine the way it is.
Okay, so I will get rid of the old and get rid of this.
I have a question. Let me see. Okay, we're back. Public health.
Okay.
Should there be a to ensure or an ensure? Just okay, that's fine. I'm good with that.
Public health and leader regulations, nursing practice, creating this regular practice. And ensure. I mean, you said we're going to have a time to come back to this again. Right?
Yes, and that's important. We're doing a draft today, but it will go to the board staff for possible edits, and then it'll go to the board also perhaps for edits, and then eventually approval. So,
Sometimes stuff like this, I better if I
You-
sit with it for a while and then.
right.
I think this is a good jump point. I mean,
Okay.
it's a definite good start, I think.
Okay.
Does anybody else have any other comments?
Just responding to the last comment, I think it's correct as is, without the two. If you wanted to say two, you'd have to rewrite it.
Okay. So I'm going to go ahead and move on to the values. So the values, these are the current values of the board. They represent your culture or what you'd like your culture to be, how you want to interact with your stakeholders, how you want to go about realizing your mission statement. So are you good with these values, or do you want to add or take away any?
I don't think consumer protection is a value. I think it's part of our mission, right? But I don't see it as a value.
Okay.
And customer service too. Maybe it was excellent customer, maybe it's excellence as a value.
That could be a value. So do people want to remove consumer protection and replace it with excellence, or remove consumer protection and add excellent customer service? How do we feel?
Would we be interested in adding transparency?
Yeah, I would take, yeah, I don't think trust is a value either, but I think transparency, I like that a lot. That would lead to
Okay.
trust.
Okay, so shall we do this?
Can we say consumer advocacy? Protection is pretty strong.
In the values, I don't know if this is correct or not, but something about collaboration, partnership.
I had one comment, this is Lori, on consumer advocacy, and I know you put that up there, Dolores, but we are a policymaking board, not a lobbying board, so I don't know that we can truly do advocacy. So that might be a concern.
I like collaboration.
Okay. And typically,
There's something else we can put instead of customer service, some other kind of wording.
Yeah, again, those top, I would take both of those top two out, because this is like how we do things, not what we do them, right?
Oh, that looks good.
Yes, integrity, transparent. What about fairness? Because I think that's one of the things we try to do a lot when we're making decisions is how we handle integrity, effectiveness, integrity, transparency.
Isn't and fairness the same, kind of the same? Integrity and fairness?
Integrity and fairness?
I think they're different. Integrity is, doing the right thing always. And fairness is treating people equally, essentially, kind of is how I kind of see that.
I don't know, Reza, what do you think?
I tend to agree with Lori. I see them as different. I have a hard time kind of explaining how they're different, but integrity, I don't know, to me, it's kind of more internal. I do, like Lori said, I do the right thing all the time. Fairness is more, again, this is just the way I kind of conceive it in my mind. Fairness is more external. I treat everyone fairly, and there may be some overlap by, treating people, by acting with integrity. I treat people fairly, but I just see them as having different connotations, different enough that, you know, I'd be comfortable with both of them in there.
All right. So boards typically have between 5 to 8 values. So you've got a nice number of values right now. Would you like to leave it as it is?
I'm good with how it is.
Yeah, I'm in favor of leaving it. I mean,
okay,
we're going to go over this one more time. So
yes, yes.
But yeah, I like how it's concise,
Mhm.
not wordy.
Great. All right, so we will move on with covering objectives. So
I'm sorry, can we put something like ethical on the last one? Do we need to put something about being ethical?
you do have integrity, but
That
again,
being ethical?
if you want to add ethical or ethics, or I can.
I don't know. I'm just throwing it out there. I don't know if it's the same as the others.
I see that as part of integrity, but
Okay.
I know in some ways being ethical.
I'm just saying, you know, with everything that's going on with Black lives and all this, you know, injustice or whatever, that we put something in there. And I don't know if ethical is the right word, but if we put something in there that
equitable.
Or equity.
That's
equitable or equity.
Equity. Yeah, I don't know if that's necessary.
Okay.
just like, can you think of a word, or do you think we should not even include it?
Sorry, was that for me?
Yeah.
And the question was a kind of a synonym for
Ethical, you know.
To me, again, this is me, but to me, ethical and integrity kind of overlap enough that, you know, I'd pick one or the other. Again, that's just me. Equitable, I guess, you know, that kind of, I'd go with equity over equitable, but
I'm just looking for something like being systemic, you know. Okay, we can move on.
are we keeping the last one or no?
Right.
I like the first 5.
Okay.
Sounds like the consensus is a strike.
Yeah, but this is a draft, right?
Yeah.
It is. It is. So you can come back and revisit it. Okay.
By the way, this is Reza, just a real quick procedural comment. Typically, you know, with our ordinary board meetings, we go agenda item by agenda item, and each one we take public comment. This is obviously a little different because it's, you know, all of our strategic planning is under one agenda item. I noticed we have at least some folks from the public lingering. So I just want to put it out there that I mean, typically under Bagley-Keene, we take public comment once per agenda item, but I just want to put it out there that there is an opportunity if there are certain issues that you want some input on. You know, I'll leave that to Dolores and the other board members if you want to open it up at any point to the public. Obviously, I know we have a lot to get through, but just wanted to remind that is something we can do in case you want further feedback and input.
Yeah, if the members who are of the public would have any comments on what we're thinking about for mission, vision, and values.
Okay.
I don't know.
Yeah, I'm all for that.
Okay. So let me go ahead and switch to the other PowerPoint then. All right. So I will go ahead and open up the Q&A panel.
By the way, Tricia, I'm sorry, I see you have a slide for that, so I'm sorry if I kind of jumped in and suggested that at a different time than you already had in mind.
So we had planned on having public comment at the end of each goal area, but I hadn't realized that we would get so into changing the mission, vision, value. So I'm glad, Reza, that you recommended it because now we can get feedback on that as well. So if any member of the public would like to comment on the mission, vision, values that the board has crafted, please type. I would like to make a comment using the Q&A panel in the lower right-hand corner of your screen. Submit your response to all panelists. And we are displaying instructions for your reference. We'll just give you a moment to access the feature. Okay, so I am looking at the Q&A and I'm not seeing anyone requesting public comment at this time. Are we okay with going back to our other PowerPoint?
Let's give it one more minute.
Okay.
People may be trying to access.
Okay. All right, so good thing we had that extra minute because we have a Catherine Hughes that would like to make a comment. And in keeping with board practice, public will have 2 minutes to speak. I won't interrupt your thought process with a warning. I will simply mute you and go on to the next person when 2 minutes are up. So Catherine Hughes, I'll let you know when you've been unmuted. Okay, Catherine, you've been unmuted.
Hi, can you hear me?
We can. You're a little soft, but we can hear you.
Okay, I just took myself off my earphones to see because I couldn't hear myself. Hi, this is Catherine Hughes, registered nurse with the Nurse Alliance of SEIU California. I just think that maybe considering the word equity in place of the word fairness is just a thought.
Okay. And I'm not seeing, oh, go ahead, please. Okay, I'm not seeing any other requests for public comment. Do we want to wait a little? Oh, we have someone that agrees with Catherine. Okay. So we have a Dante Segundo who has written a comment rather than requesting to be unmuted. So I'm assuming he has no mic. Would you like me to read his comment?
Sure, we're not able to see it, I guess. No?
Okay, so the comment, his
here. Okay,
oh,
I see it.
oh, okay, so the comment on integrity, I see it more as having consistency between one's internal self and what one presents externally. This is comment. Okay.
Tricia, are you able to pull up the slide that shows what we have now?
I can. I just let me switch back to the other PowerPoint. Just we've got two loaded.
Oh, sorry about that.
Oh, no worries. So
Looks like there's no other comments. We can probably close the comment window.
thank you. We'll go ahead and do that.
Yeah.
Okay. And let me go back to our values. So it sounds like someone was suggesting replacing fairness with equity.
Yes.
I could support that. I just looked up on dictionary and the definition for equitable is fair and impartial.
Okay. All right.
You want the value would be equity or, yeah, equity, I guess you're right.
Oh.
Practice, integrity, transparency, collaboration, equity. Yeah, equity, yeah.
Okay. Excellent, thank you. All right. So I hope this slide looks familiar. You should have received a objectives worksheet in your preparation for this meeting. And so when we get to crafting objectives, we want them to be SMART objectives, and that just is specific, measurable, action-oriented, and realistic. So an example of an objective that is not SMART would be someone setting a goal of being a nicer person. While specific, people's definition of nice is different. Measurable, hard to know what's nicer. Action-oriented, again, very vague. Realistic, possibly. Time-based, not at all. But if someone sets a goal of, I'm going to smile at and greet 2 people a day, that's very specific. 2 people a day, you're smiling, greeting. Measurable, yes, 2 people each day. Action-oriented, you're smiling and greeting. Realistic, I think we can all smile at and greet 2 people a day. And time-based, yes, you have a day to do it. So very simplistic example of what a SMART objective is. And when you get into crafting and brainstorming objectives for your strategic plan, we just want to make sure they meet that formula. And to help that, we have this objective formula tool. So when you brainstorm objectives, you'll start with an action. So it'll start with a verb, the goal or the issue, and then the benefit. So in this first example, it would be the objective in its entirety would be read as create an expert witness manual for subject matter experts to increase effectiveness of reports. So this is what we want to keep in mind as we craft objectives. And your resources for the strategic planning process today are your objectives planning worksheet. That's the first one. You have the environmental scan, which is your stakeholders telling you what priorities they feel your new strategic plan should address. You have your old strategic plan, and then you have the goals with their statements. So you have your day-to-day operations and their definitions. And then you have your updated mission, vision, and values. So as you create objectives, you'll want to ask yourself, does this fit with the mission statement? Does this objective help carry out the vision? Does this objective match the values that we have? So those are your resources. And your roles and responsibilities, the strategic direction of the board rests in the hands of those involved today. The executive officer and staff will be responsible for implementing the strategic plan and ensuring strategic objectives are completed. So please keep in mind the staff have limited time and resources. Typically, we say to craft 3 to 6 objectives per goal area. Obviously, you can create less or more than that, but that tends to be a good number to aim for, between 3 and 6. And then consumer protection is the board's mandate. So we're taking an hour for lunch. It is magically 12 o'clock right now. So I think it would be a good time to break for lunch and return at 1 o'clock. We can keep in mind what we've discussed already, and then we'll come back from lunch at 1 o'clock and we will start to brainstorm for licensing, our first goal area. How does that sound?
Yeah, can I just make one statement that I've been thinking about? But the 2018 to 2021 strategic plan, I have not felt like we have, in a consistent way, at least not to my knowledge, gone back to that strategic plan and assessed how did we do, or that we look at it on a regular basis. And so I was sort of surprised to even, I mean, I know I'm still less than a year on the board, but it took a long time for me to even know there was a strategic plan. So I know that's not the purview of this, the work we're doing today, but I do want us to keep in mind that once we do this work, we need to go back to it on a regular basis and ask ourselves, you know, are we really accomplishing what we set out to do? So just a thought.
All right. Thank you. Thank you, Mary. All right, so we will be returning at 1 o'clock, and I hope everyone has a good lunch. Just remember to mute your microphone and turn off your camera.
See everybody at 1.
Thank you.
Your lunch.
Is licensing, and you can read the definition of licensing that the board has come up with. If you want to make any changes to that definition, let me know. Otherwise, you can just keep it as it is. And I did open up the chat in case someone isn't comfortable just unmuting themselves and speaking. They can also send me a chat to the host or to Tricia St. Clair or to my co-facilitator, Elizabeth Cornell. And we have Ken joining us, Kenneth Malbrough. So I just promoted him to panelist. So I'm not hearing any or seeing any messages to change this licensing definition, which is perfectly fine. We can keep it as is. So my second question is this: before we jump into generating objective ideas, does anyone want some time to look at the environmental scam report, or are we ready to just jump in? I'll look for hands.
I have a question regarding licensing.
Okay.
And allow access to the profession. Are we the ones that allow access to the profession, or is it the schools? Just throwing it out there.
Yep. And again, this statement was written by the board, back the last time. So if you want to change it, you're
I'm just
welcome to.
questioning it. I mean, are we the ones that allow access to the profession?
Yes, Imelda, this is Mary Ann McCarthy, nursing education consultant, liaison to ELC committee. Yes, they need to graduate from an approved program. However, unless they're licensed, they cannot enter the profession. So we do hold licensing.
That's the wording.
All right. So in that case, my second question is, do people need time to, like a couple of minutes to look at the environmental scam report, or are people ready to start throwing out objectives for licensing?
This is Reza, real quick, Board Counsel. I just going back to Imelda's comment. I mean, I agree with what Mary Ann said about, yes, we do kind of in a sense allow access to the profession by issuing licenses. When I read this initially, that phrase did still kind of jump out at me, allow access to the profession. I don't have too big of a problem with it, but it catches my attention. It kind of makes it sound like we think we're, the gatekeepers, and which in some sense we are, but I think it just kind of stands out to me like we kind of see ourselves as I'm not sure how to say it exactly, but that phrase catches my attention a little bit. I think the general kind of premise, like going back to what I was saying earlier about the legislature's comments and our mission statement and all that, is that we don't keep anyone out of the profession other than people who are not qualified. In a sense, that is technically allowing access to the profession, but it's just kind of the connotation. I think that, rather than keeping out unqualified people, this to me in my head kind of conveys a slightly different twist on that we only admit qualified people into the profession rather than us preventing unqualified people from joining. We only admit qualified nurses. Super fine distinction there. And again, I don't want to kind of belabor this point, but I just wanted to chime in since Imelda brought that up, that phrase
What if we said
grabs
something
me a
else?
little bit.
Promote, how about promote?
Or support access to the profession to qualified individuals? To me, part of this speaks to, sort of timeliness and, right, issues that have been brought up.
So I heard two suggestions. One is support access and the other is promote access to the profession. Do we have a preference?
Support, simply because we already use promote.
Okay. That
But I
sounds,
would add at the end, I would say to qualified candidates or something. Qualified individuals, maybe.
okay.
Does that address your issues, Rosa? Are you concerned?
I think that's, yeah, I like it. I don't know if anyone else had the same, thought process that I did about that phrase, but, and again, I just want to reiterate again, it's, it may be something that I'm just overly sensitive about it, but,
Red sort
I
of
wanted to
way.
put it out there.
I like the add-on.
You don't or you do?
I do.
You do. Okay.
Yeah.
Okay.
I would just replace the word by to,
For,
yeah, for qualified individuals.
How's that?
Yeah.
Okay. Wonderful. Okay. So now are we ready to brainstorm some objectives for licensing, or do people need time, a little time to look at the summary?
are we gonna, or is there a goal and then objectives? Is that?
So the objectives are what you want to accomplish in the goal area of licensing. So based on the priorities that your stakeholders have underscored in the environmental scan, and based on any opportunities and threats they pointed out, you're going to craft what you want to accomplish in the area of licensing in your new strategic plan.
So maybe this statement we just worked on is really more towards the goal. So the goal is to promote licensing standards that protect consumers and support access to the profession. Is that?
Yeah. So yeah.
I would
So
say
each
have objectives towards a goal, right?
Yeah. So the goal area is licensing, and what you just workshopped was the statement that defines that goal area. So now we're ready to brainstorm what we'd like to accomplish in this goal area. So we're going to use the formula where we have an action, which is a verb, the issue, and then the benefit. And the objective worksheet that you were given as part of your materials for today has a list of verbs at the back. Certainly you are not limited to those verbs, but if you're struggling to come up with one, that's just a jumping off place for you.
You know what? To me, it might be a little more helpful instead of going to direct objectives would be to sort of talk with the rest of the board members and others about what are our overall goals towards life. I think, because especially when we look at the feedback that we received, I mean, there is pretty significant dissatisfaction with the processes. So I think we need to, really think long and hard about what it is we want to accomplish in that regard, and then say it, and this is how we're going to do it, right?
Yeah, that's excellent. So if you want to discuss that, please go ahead and just let us know when to start typing.
I think that from the weaknesses that were identified were accessibility was a weakness. So I think we want to improve accessibility, right? People also said long processing times. We want to improve processing times.
Probably another area was communication.
Yeah. I would say we would want to probably have a statement that would address one or more, to address every single one of the weaknesses that were identified, and then certainly make sure that nothing is going to get away of keep continuing the things that were identified as strengths.
So, go ahead. Who was going to say something? I was just going to ask Lori, there's some improvements that the board is working on with regard to some of these issues.
Yeah. So yeah, we have a lot that we're working on in regards to these issues. So accessibility, we just updated our phone system. There is no longer any hold times. What they do is they enter a callback number and then we call them back. So the hold times have been eliminated. However, the only way to really address the long wait now for the return call is to really have the reasons that they're calling addressed. And so we are working on that. We joined with DCA. We are part of what's called the Enlightened License Project. We are the first board to have that assessment with recommendations. We've received 2 recommendations to date. One of those is to stop the transcript process for our in-state approved California schools. They will upload essentially a candidate roster, which will then grad them out in an automated fashion in Breeze. So it will not require licensing people to go in and manually touch that application. That is slotted to potentially roll out before the end of this year. That will dramatically decrease the processing time for our in-state California graduates. And when you look at that in a ratio, that would be over 50% of our licensing taken care of that way. So when we look at our numbers in the beginning of this year, from January forward, we have about 4,000, as this is the beginning of last month, so June. So we are not counting our grad season, which just happened. We have about 4,000 in-state graduates, and then we have about 1,000 that are asking for license by examination from international, and about 500 asking for license by examination for out of state. And so I'm just talking about the license by examination, the initial license process through here. So that would handle that tremendously, a tremendous load off. And that would then immediately give them eligibility for ATT through Pearson VUE, because they would have their fingerprints with live scan turned in, because that's done through the school as part of the application process. Their 2x2 passport photo we're working on. We have a lot of deficiencies when they don't submit the 2x2 passport photo. We're looking at creating a hard stop with that, so that if the passport photo is not attached, the license application will be rejected until it is attached. So that's a process going into place too. So we will not have deficiencies any longer. And then those will receive a license to, an ATT to test, probably within about 30 days, or sooner. And so that is really something that's going to be a tremendous support. The holdup would be the person that has accommodations, because that requires a hands-on, eyes-on, and then a person that has an enforcement issue, and that would require hands-on. And so that should be an automated process with the target date end of this year. So that will decrease a ton of licensing time. When you take the majority of the transactions that we do, which is licensing by examination for the California grads, then that will then open up staffing to address the endorsements, the verifications, and all of the other in out-of-state and international grads that are wanting licensing by examination. So that's a big fix that we're doing. The other thing is we did this big push to get all of our applications online. So no longer a cashiering process and no longer a mailroom process. That is part of, you know, the timing for everything that goes through and gets processed. So with an online process, that's automatic. You don't have to wait for the mail. It doesn't have to go through the mailroom. It doesn't have to be separated and sent to licensing. Additionally, that takes away the cashiering process where the check comes in, it goes to the mailroom, it gets delivered to cashiering, cashiring's check cashes it, and then it goes to the licensing department. So going online, that has bypassed that, and we will be taking down the paper applications that are on our website, so that we will be doing all automated that way as well. So those are the big things that we were initial ones for the Unlicensed Lighten project, that's going through. The accessibility that was talked about, we did just roll out an application status and details process on our website. And so they know in our Breeze account, when you go on and look at the page, when you do an application, it just says pending. It doesn't give any true details. And so with the application status and details page that was just rolled out, you can click on that. You enter the last 4 of your social security number, your date of birth, and your name, and you find your application in there, and it'll tell you exactly what's deficient, what's the holdup is, where it is in the process, and it is a real-time check. And so that should now, that just rolled out last week, that should decrease some of our phone calls too, which would be the accessibility. So there's so many different things that we're looking at to increase accessibility, but then truly looking at decreasing the need for people to call in. And that really is it, because if we're providing a service and we're doing it well, then people don't need to call us. People don't need to contact and email and follow up always, because they're just going to apply and get what they requested. So you have to fix, and as you guys know in nursing, you always address the underlying issue versus just fixing the symptoms. And so there's a huge underlying issue here, and that's really to deliver the service that we said that we're going to do in a timely fashion. And so these are all things that we're looking at and implementing. It does take time. We did get an IT consultant because our pro rata is through DCA. They're handling us with all of the other boards and bureaus. So we did hire in a separate IT consultant above that pro rata to help us with all these technology implementations.
Can I ask a question? I mean, thank you for all that. It sounds like we're two steps or 5 steps ahead of what the deficiencies. Nonetheless, I think we still have to address it here. You know, if we have those things in place, great. But as far as, you know, the deficiencies that were identified, I think we're still going to have to list them here. And again, if we're already there, so I appreciate all the background information, what you're currently doing, but I think we still need to address the deficiencies. And again, if we're already there, hey, more power to us.
Well, maybe what the goal or the action item objective becomes to implement the improvement activities so that we can reduce licensing times to below a national benchmark or whatever by whatever. So maybe that's what we want to say. It sounds like things are already happening, but I think in terms of our strategy, and clearly that is a strategy, right? We're trying to get this better, but I think we need to write it down, make it time-based, and hold ourselves accountable.
So I agree with Lori to put this out.
So this was.
Go ahead.
Sorry, Dolores. So I agree with you, Mary. We definitely need to write this out, put it as a plan, because it is in process. It is not completed at all. If it was completed, we wouldn't have these complaints still. But we are not completed. Everything is in process. So I think this is the perfect opportunity to write down some of the stuff that we are working towards and implementing.
And that's the very reason why I asked you to state that, Lori. Thanks. Is maybe we can fit some of this into what we're currently implementing now so that our so that we can, we can say, yeah, we're working on it, but some of the things that we're doing now, we can fit into our action. Can we see?
I'm sorry, yeah, can we see the deficiencies? Can we just start with there and,
That's what I was
those are
gonna ask.
the issues. I mean, we can go on and on, but let's identify, let's show up here what those deficiencies are, and then maybe we can work backwards or forwards or whatever, but if we can list those, that would be really helpful. And again, if we're already doing that or we're already there, so what? I mean, we still need to identify because it was a deficiency that was identified.
No, the first issue is excessively long licensing times, right?
Okay.
The other one was lack of accessibility. The next one I read was poor communication. And then there was concerns about fees and carrying a card.
So around the card is that licensees would like to have a tangible card, correct, Mary?
That's what it said. Stakeholders request a return to the physical license, a card that can carry in their wallet, saying that would be more convenient and safer in a state of emergency with computers down and online license verification unavailable.
Can I add something? This is Ken.
Hey, hi, Ken.
Hi, sorry I was late into this. I read a little bit of that, but there's one thing that I see a lot of complaints to me personally is licensing verifications of California RNs leaving, the amount of time and the cost.
I mean, when they go to another state and try to
Yeah,
get,
yes, yeah.
Okay. So would that be licensing verification for
Timeliness.
licensees?
Yeah.
Or timely, okay, timeliness.
And cost.
Okay.
So are you talking about coming into the state?
Oh, no. I'll just use it by example. An RN leaving California going to Arizona, and it still shows 3 to 4 weeks, and the cost is higher, and they always bring up nurses where it's a little cheaper and faster. And so that's what I hear as the emails that I get.
Okay, so should it read licensing?
Does that explain what I'm saying, Dolores?
Yeah, now I get,
Yeah.
that explains it better.
And it's both directions too. It's people coming into the state trying to get licensed. It happens a ton when you're trying to recruit traveling nurses, which was a real issue with COVID.
Okay,
And so that would be called licensing by endorsement.
Okay.
Okay.
Okay. We can work on a benefit that's more timely and less expensive. So more timely and less expensive. And again, we're just brainstorming and we will refine these.
Which is different than the compact, correct?
Yes.
So I know that's been brought up a lot.
I would like to put something in here that over the next 3 years, we would investigate joining the compact or becoming compact state, however you terminate it. I think that should be very important for us to really critically evaluate.
So nurse licensure compact. So joining the nurse licensure compact. Okay. All right. Any other issues? We have plenty already, so it's fine if we want to just start coming up with action words or benefits. All right. So does anyone want to throw out an action word for this first
would
one?
say reduce.
Okay. And the benefit would be?
To improve access and satisfaction.
Okay. How about an action word for lack of accessibility?
I don't want to be the only one to speak up, but I would say improve.
Yeah.
Yeah,
Okay.
I'm looking at the list.
Okay. Okay. And maybe we could even get rid of lack of and just say improve accessibility. So accessibility is the issue, and then improve accessibility, and then the benefit.
Okay, so this is really to improve satisfaction.
Okay. And again, people can feel free to send a chat. If they don't want to speak out, they can send a chat to myself or Elizabeth Cornell, my co-facilitator.
Can I ask if under this section, I mean, is this where we would look at a simulation? And that's been a big topic.
That's under education.
Yep.
Education? Okay, thank you, Ken. Thank you.
We could probably put accessibility and communication on the same line, don't you guys think? Communication and accessibility. I mean, first it was just getting someone to answer the phone, but then there was also issues about the responses they got when they did.
Okay.
Yeah, that works.
So maybe would enhance come under action for that?
Yeah, you can change
We're
improve to
enhancing the
enhance.
current system to help accommodate or resolve accessibility and issues with accessibility and communication.
That's good.
Okay. And then with fees, what would we like to add for an action word with surrounding fees?
I would say something
Yeah,
about
yes.
ensuring that fees are either reasonable or.
Okay.
I think also analyze.
So maybe analyze and ensure. Okay.
Be reasonable. Yeah, and in line with other states or something like that too.
Okay. And in line with other states.
Where are the boards? I mean, want to look at our boards here.
Maybe states/boards.
Yeah.
Was that, the Board of Registered Nurses, we hadn't increased ours forever and ever, but yet all the other boards had increased their fees all along. And so when we finally did it, people were shocked.
Okay.
This is Reza. I just want to throw one thing out there about fees, and this isn't necessarily the suggested change, but for your consideration, our fees need to be set so as to cover the board's costs. We look at the board's budget every so often and, see that we've got X number of months in reserve, and if that starts to dip, then we need to reassess fees to cover costs. So while it is, definitely important to monitor our fees in relation to other state boards, if setting a fee lower to equate it to another board wouldn't cover the board's cost, then you've got a problem, obviously. So just something to keep in mind. I don't know that that necessarily requires a revision to this piece about fees, but
Reasonable in line with other boards, but cover costs. But if the costs are so much more, then that would be something we'd want to question, like, why would our cost be so much more than others?
Okay.
This is a reason why we increase the cost, because we hadn't increased them in forever and ever, and that was not the reason. The reason is that we just didn't have the budget to staff or the manpower. I mean, we couldn't, because we didn't have the money to do everything that we wanted to do or we could do, and it caused a lot of problems. So we had no other option but to increase the cost that we hadn't for years and years and years. So yeah, I agree with Reza. We definitely need to look at our overhead and our costs and align it with that. If not, we're going to be back at the same we were, 8 years ago, where we can't, yeah.
So maybe we need to add at the end there, after boards, while covering costs. So fees are reasonable and in line with other states while covering costs.
Either that or the benefit could be to cover costs and remain equitable.
Okay. To cover costs and remain equitable.
While being equitable or something like that.
While being equitable. Okay. Okay. So shall we take away while, yeah, there we go. Does that look good?
This is Reza. Just, this is good. I have no problem with it, but
okay, good.
Just want to throw out another phrasing in case, if you like fancy words, you could, the benefit could be, and again, current phrasing is perfectly fine, but to ensure fiscal solvency while also ensuring affordability for applicants or something like that.
Okay.
Also ensuring affordability to prospective licensees or applicants or.
Okay. So do we want to change the benefit then?
That's fine.
Okay. So we'll switch to ensure the
That's
fiscal.
Yeah, that works for me.
Okay.
Can we just add to ensure fiscal solvency for the board? Is that too many words?
No, that's fine.
Okay, it's pretty obvious what we mean, but.
Okay.
Reza, I'd actually suggest that to be the Board of Registered Nursing, because when we refer to the board, it's the 9-member board.
Okay. So we can just put maybe BRN or
BRN, fiscal solvency.
Yes.
Yeah.
There we go. How about this next one?
Can anyone provide some additional information on that about like how frequently that came up? It's not something that I've heard very much.
About the increase?
No, the having a physical license card.
Yeah, the older nurses like to have something in their billfold, something that they can show. I think that if they wanted a card, I think we could make it available to them where they can print it, but then that they can print their own card. We don't have to mail it to them.
So I'll jump in here really quick. This is Lori. I'm not sure that this would be a benefit, so I'd like to open up a discussion for this. We are moving, DCA boards and bureaus are moving to digital licensing. That is an online license. So with that, the BRN went to a license that is online in a process to go green, essentially, as well, because it was quite costly to mail out a physical license each time. However, that is budget, and we can work with that. So it's not a cost issue per se. That is just something to take into consideration. The safety aspect that is of the concern is a hard card does not ensure that a license is current. It does not ensure that it has not been suspended or revoked. Going on and physically doing the online verification through Breeze ensures that the licensee is still current and that there has been no action taken against that license. Once you issue a card for 2 years, they have that card and there's no update to that. So that is something to take into consideration with that when we're looking at patient and public safety.
This is Reza. Oh, go ahead, whoever was.
Oh, I was just wondering, was there anything during this pandemic time where this was an issue for someone who did not have a physical license card?
We did receive a couple email communications around this, not many at all, but there were a few communications around this. What we ended up talking about was having them print off the license verification page that is already available. So you can click on your license verification page and do print screen, and it prints it. You could also save it to a PDF and keep that in your phone or whatever you have on you. As we know that cell phones are with almost every single person that has that. And so there is that. Additionally, one of the comments in this was that downtime, and Breeze, the verification system has not, that license and verification is down a minimal amounts of time. And again, if you have it saved in your phone, it has a date time stamp on it. So if we were to type in Dr. Mary Fagan's license, we can come out today and it'll say at 6:16 at 1:39 p.m. that she is licensed and current. And that there's no disciplinary action against her license. And we can verify that for today. I could then print that if I wanted to, or I could save it as a PDF and keep it on my phone in the notes section, or screenshot it and keep it as a photo in my phone, but I could have it right there.
Yeah, I'm not sure this is something that we want to address in our strategic plan. It feels just, and probably, right?
Right, I don't think so either, because what we have in process in place right now, I think it should work. As of today, at this time, my license is good, and you should be able to print that. Yeah, I mean, it could change tomorrow. So, you know, we do that for Medi-Cal eligibility. I mean, if someone doesn't have a card, I have access to the state, and I could print as of today's date, this person is eligible, has services. But tomorrow that person may not, so it's only good for that one day. If they need more than that, I guess they could print it every day if they're job searching.
Okay, so it sounds like we're gonna get rid of the physical card. So we're just moving
Employers
up.
don't ask for your hard copy card. They all look online.
Okay.
Required to do primary source verification.
Right. So we'll just move their brainstorming to this slide. So our next issue is licensing by endorsement. And what would we like to do with that? What action?
So would it improve? Yeah, improve.
Improve. Okay.
Yeah.
We already have a benefit, but do you want to tweak it?
It's improve the processes for licensing by endorsement.
Okay.
Or streamline? Do we want to streamline? Or is there anything that needs to be streamlined?
There's a lot that needs to be streamlined. I could say what we've done and what we'll continue to do and move forward with as well. When I came in last year, we had licensees on microfilm and microfiche. And so we had to do a hand typed process where we had to access that in order to endorse out, or sorry, this is endorsing in. So I will not talk about that part. That's verifications. Endorsing in is time, definitely. It does get caught up in that processing time too. A lot of that is based on fingerprints. The live scan process has to be done in California and can only be sent to California if it is in California. And just by the nature of the process there is they're coming from out of state, they're licensed in other states. So that has to be done through a hard card process that goes to the DOJ for processing. And that is the largest part of the delay. What we changed in processing, what our licensing team came up with is that they would run a report daily, and anybody that had fingerprints that came back from DOJ cleared that day would be processed that day. So they are not delayed anymore on our end. The other part with that is just looking at staff time. And so when it kind of has that compacting effect by when we look to clear up the transcript issues with the in-state students, that allows for that to be an automated process, which would then allow more time to be focused on these other issues. The other thing with endorsing in is we did get it onto an online process, which is great. Transcripts are an issue. We do right now still require transcripts being sent directly from that school. We'll look to see if we can get into alignment. There was a new bill that was passed in July of last year that requires all schools that offer a degree for license in every state to list whether or not they meet the licensing requirements for that state. And so based on the passing of that bill, when schools get into alignment with that, working with NCSBN, we may be able to get a full listing of every school that meets our licensing requirements. That would be the ultimate goal, and we could process them quickly without doing an in-depth transcript review. Right now, every analyst, every licensing staff has to review the transcript to see that it matches 1426, and we could already have that set. So if they got a degree from that school saying that it completed it, we wouldn't have to do an actual evaluation of the transcript. We can just process it, which would speed that process up. The next thing is with the licensing process we discussed before is fees and the 2x2 passport photo. Those are deficiencies that are common. So we have looked to start a process. It's in process, has not been implemented, which we will do a hard stop for the 2x2 passport-like photo. If it's not submitted, they can't submit the application. And that's the same with fee. If the fee is not submitted, they would not be able to submit the application. And then lastly, which is kind of a loftier idea and something to consider, a lot of deficiencies are issued on microbiology requirement with lab. There are several schools throughout the nation that require microbiology, but not microbiology with a lab. And in our regulation, we require microbiology with a lab. So if you graduated from school 20 years ago and were working as an RN and you want to come to California, if you did not take microbiology as part of your pre-licensure program 20 years ago that had a lab component, you are denied licensure into California, issued a deficiency, and then you need to retake microbiology with a lab in order to come in and be licensed in California. So there's a lot of issues that have been uncovered with this process, and I think that would take a larger discussion on what we think we do, because we'd have to change regulation if we change the microbiology with a lab requirement. We may consider that if you have a license for a specific number of years and you've been practicing, that they wouldn't require it, something to that effect. But those are the issues that I have identified through working with our licensing team, who have brought these forward to me, and stuff that we can look at on improving the endorsing into California.
What is the regulation, Lori, that requires the microbiology and lab? I do think we might want to pursue that.
Yeah, 1426, 16 CCR 1426.
And this is the facilitator. So a lot of what we just heard would be carried out in the action steps. So we've got the objective to improve the process for licensing by endorsement. And then we would during action planning, we would break it down into steps like, okay, how are we going to improve it?
So we wouldn't streamline it, we would just improve it.
You can change the action verb to streamline, but in terms of, okay, how are we going to improve it? All those details and steps that, like what we heard that's being done, those would be action steps that to accomplish this objective. So after we finish today, we'll have a draft of a strategic plan. Once it's edited to your liking and approved, then the next step is going to be action planning, which is where we look at these objectives and break them down into steps. Okay, how are we going to, for example, how are we going to achieve streamlining the process for licensing by endorsement?
During that time, do we get into a deeper discussion?
So the action planning is done by this, is just for the staff because they're the ones that will be carrying out the steps. However, when you go to approve this strategic plan, if you wish to discuss it further, you can. And yeah, so I just wanted to throw that out there.
I'm just saying for the sake of time, I don't know if we're going to be done by 5. I need to be off by 5. So I mean, I don't know. Are we thinking that this is going to go longer than 5?
We will do our best to finish by 5. You know, it helps if people come with objectives already written. That is always our hope, but we understand that's not always possible. That's just a perfect world situation. So we will do our best to finish by 5. I just wanted to throw that out there because sometimes people get caught up in the details of how they're going to do this. And right now we're just coming up with what we want to accomplish in each of these goal areas. So for this next one, investigate joining the nurse licensure compact. What would be the benefit to investigate?
So this is something historically that the board has opposed. And this is legislation. I don't know that this belongs on here. It's certainly something that we investigate every time a bill comes through, every year through
if we
legislature. So I don't know that it really belongs on here because it's a specific bill. I mean, for that matter, why don't we list the other bills? So joining the nurse licensure compact, part of that is also nurses can come into the state with per endorsement. So there's a process in place there that nurses can come into the state. So I believe that this part needs to be taken off.
Okay.
I don't agree.
I disagree too.
Okay.
I disagree. I think we need to keep it. We need to keep it there. This has come up since I've been involved a long time, and this board, not this board, but the boards. I mean, they're just so resistant. They're not willing to. You know, we've had presenters, we've had research, I've done a lot, and this for some reason, California Board of Registered Nurses is just closed to the idea. It's been brought up many times, so I think we need to keep it here. So I disagree with Dolores.
This is Jovita. I agree with Dolores because this is not this. I mean, we just went through a mission statement saying that we want to protect the not just the residents of California, but also whoever comes to our state to get equitable health care. And this, the compact, it's something that probably belongs in legislature and not here.
What I would suggest is that we investigate supporting joining the nursing. We just investigate it and see the evidence instead of just writing it off that it's automatically bad. And I would put the benefit could be to increase access to care while maintaining public protection, because that's totally what we would want to do. It wouldn't make any sense
to do that in any circumstance.
Exactly, but I think we have written this off as a bad thing without critically evaluating it. It's certainly in my experience on the board, and I think it's time to relook at it.
I have a question for Lori, and just yes or no on this. I didn't in the sunset, one of the things that they asked is for us to actually look at that. Yes or no?
Yes, and I think the word investigate is perfect for that.
Outstanding. Thank you. It's good enough for me.
All right, so it sounded like.
I'm sorry, this is Rez. I just want to make one quick comment. The piece that I'll let you finish, Tricia.
Okay, all right.
All right, so is that the phrase? I'll just say the piece that I have a slight issue and hesitation with is the word joining, at least in the issue, because, and that's in consider. I don't take a position either way on it, but in consideration of the board's position that it's taken time and time again on this, the current phrasing kind of suggests that that's the direction we're going, joining. So my suggestion, again, just for whatever it's worth, maybe revising the phrasing to something like investigate the merits of the nurse licensure compact, or investigate the pros and cons, maybe think of a better word for pros and cons, but that kind of a concept. But just rather than investigate joining, which again, this is maybe me being just reading into things too much as I do. But that's kind of the impression that I got, that it kind of suggests, okay, it's one of our objectives to investigate joining it. That kind of suggests we're thinking about joining it, and that's kind of where we're headed, even though, like I said, time and time again, it's come up and we've
Maybe it's
explicitly decided not to.
the merits of joining, just as you said, right?
Sure.
So how would this increase access to care while maintaining consumer protection? I mean, the nurses in this state and our new grads, I mean, this is something that they would set out to do anyway. This is something the employers, the hospitals would do. They can do that with nurses already in the state and with the new grads coming out. So I'm just kind of curious, Mary, how your thought process is as far as increasing access to care while maintaining consumer protection.
It would certainly improve processing times. And that access to care, in a perfect example, is having qualified traveling nurses be able to come and take care of patients in your ICU in a COVID crisis. And we had to wait, not so much me in pediatrics, but I've heard from many of my adult colleagues, the waiting time for that, for people who are eventually going to be licensed. They didn't catch anybody that didn't pass licensure. The time frame just takes way too long, and it keeps people from wanting to come here who are good because they know about it. So the overarching goal would be to definitely maintain consumer protection. But if we're putting barriers for people to come and practice in California when there really isn't a risk to the consumers, I think we're making a huge mistake.
But we have nurses in California, and we have new grads that are coming out and cannot even gain employment in this state.
So is that your intent, is to keep?
No, that is not my intent.
California?
I am concerned about the nurses in California first, and the students, the new nursing students coming out in California first. And if this is something that employers or hospitals, I mean, the students are there, train them. The nurses are there, hire them.
Dolores, I think that's part of what we would learn while we were doing the investigation, right? We'll take a look at that. How real is that? What are the issues? How would this impact it? I think that's something important to investigate.
But this
I
is
think what we
something
can do here is
looked at year by year. We've looked
The
at,
investigation is great. The issue that Reza put on there, I think, is neutral, and investigate is neutral. I think on the benefit part, we could do something to say that we're evaluating it to see if we fall in line with other boards and bureaus. I mean, something very neutral. I think the conflict we're coming into right here is the board has just recently even voted to oppose the bill that put out for the compact. And so based on that, I think we can argue here all day, and I don't think that that's something that we need to do. We have some very strong opinions on why the compact is not good, and we have very strong opinions on why it is a good thing. So I think we just need to keep it as an evaluation, look at the evidence-based, and just investigate it. And I think that if we keep it neutral, we'll be able to move past this. If we keep it as this is positive and this is negative, and put that in a benefit statement that this is a positive thing, I think if we put that we evaluate the benefits of joining, and the cons, the pros and cons, we just evaluate that. And then that way it doesn't go against our board vote, because I do have to write a position statement. I do have to get that out there, and the board did vote to oppose this again. So we can't, to open it up and bring in the ledge and do that again. I think that this is not the place for that. So if we can keep it neutral here, then we can evaluate the benefit and potential non-benefits of joining or not joining, and move forward with that in alignment with the board vote, which is why we have multiple people.
thank you, Laurie.
All right. So to evaluate the pros and cons of joining,
To make an evidence-based decision.
to make an evidence-based decision.
Position, sorry. And because we do have a bill out, it's a 2-year bill. And we have multiple times, not we, but there is a bill in California. California is the we, that is out there, and we could always change that position later on based on evidence. It doesn't have to be done this year, so that's something that we can do.
Great, thank you. All right, so
Keep
we've got,
Can I propose just a quick little wordsmith? Again, I think it's good. For some reason, I don't know, to me, the word pros and cons just seems kind of colloquial and informal, even though I was the one that suggested it. But thoughts on maybe investigate the merits of the nurse licensure compact to evaluate the benefits and drawbacks of joining, to allow the board to adopt an evidence-based position.
okay. To allow the board to adopt an evidence-based position.
Mm-hmm.
Okay. Are we good with that?
That works for me.
Okay, great. So we've got 5 objectives for licensing. And before we move on to enforcement, we are taking public comment at the end of each goal area. So I want to move into that. So I'm going to stop sharing this particular PowerPoint. Try to. All right. So I will go ahead and open up the Q&A. And for members of the public, if you would like to make a comment on the goal area of licensing that we just covered, please type, I would like to make a comment, using the field in the lower right-hand corner of your screen, and submit it to all panelists. We will give you a moment to access the feature, and we are displaying instructions. And Madam Board President, I'm seeing no request for public comment at this time. Are you good with me closing the Q&A panel?
Let's give it one more minute,
Okay.
just because the last time we did have somebody
Sure.
come in that last minute. Okay, we can close the window. Thank you.
And this is Elizabeth Cornell, co-facilitator. We're going to move on to the goal area of enforcement. Did you need a couple minutes to take a look at the environmental scan? Or if you prefer, is the goal area statement, any refinements you would like to make to the statement before we start looking into the objectives?
Seeing that there's no comments, we can probably move in.
And you're welcome to have a discussion like you did for the goal area of licensing, if you wanted to start off like that. And then after a couple minutes, we can start typing up the issues that you observed.
The main issues are in the areas of processing times.
So would we say decrease processing times?
Probably decrease, reduce. And one of the things
Probably
that
reduce would probably be better.
I think in the 2018 strategic plan, there was a similar goal or objective, but the rates have actually, timeliness has gone in the wrong direction. So however we do this, we need to make sure that we've got a plan to hold ourselves accountable.
This is Ken. That brings up a question, and I don't want to hold this up, but maybe for another discussion later on. Many of the strategic plans have like a year evaluation on how it's done. And I don't recall that being done in the 2 years that I've been on the board. So it's very important that we have that to see exactly how our actions are doing.
So you have reduced processing times.
Yeah, and the benefit would be to ensure unsafe nurses don't continue to practice.
Okay.
A quick question. Is enforcement inclusive of all of our probation areas, so probation and intervention? Or are we just talking about the enforcement aspect of it? Or do we have a separate section for intervention, or is this about intervention too?
This is Tricia. It includes intervention.
Okay, so I think that we need to look at that benefit statement just a little bit differently, unless we want to clarify that the reduction of the processing time is for our enforcement specifically. Because when we have nurses in our intervention program, they are allowed to continue to practice. And the goal is to not don't continue practice. The goal is to continue to practice. So I would just ask that we look at that differently or clarify.
If you want to just say issue is enforcement processing times, would that help?
Imelda, is that more clear since this is kind of your area of expertise here? Would that clear up that discrepancy at all?
I was just thinking about the benefit. What the benefit would for public protection? I mean, because we want to reduce the time. The issue is that it takes so long, and our issue is that the public is not being protected because they're still practicing.
This is the co-facilitator. The benefit is very clear to protect the consumers or the publics, but I do want to encourage to use more specific benefits. In realistically, all of these objectives, the point is to protect the consumer or for consumer protection. So I encourage you to be specific. If there's no other specific benefits that you can add there, definitely go with public protection.
For public safety?
I think another benefit, Imelda, that we might want to consider is decrease the cost because we don't get a lot of fee recovery. And so we do incur a large cost. And so that might be something that we look at, especially when we look at how this kind of spider webs into our fees and solvency that was put forward. A large amount of our
Yeah, the longer it goes in investigation, the higher the cost, and then
absolutely,
you know, we end up reducing it. And why? Because it took so long for whoever, the investigation or the process, and so then we've incurred all this money only to reduce it to nothing.
Yes, thank you. That was very clear.
Then do we want to also say, just to your point, Elizabeth, to ensure unsafe nurses don't continue to practice, and then also that nurses on probation have adequate supervision? Would that be something we want to? And then decrease costs?
Being typed up at this moment. Yes, I believe the more specific the benefits, and if that is definitely a benefit for reducing the enforcement processing time, definitely add it.
You may also want to consider about returning to practice. I mean, that's really the ultimate goal that we have here is to have our nurses return to practice, to finish the probation program or return to practice, finish our intervention program or return to practice. Because again, that's ultimately what we want is we want our nurses to be able to work and we want our nurses to be safe and the public to be protected.
That could also, I like the specificness of this benefit, but just how you said it could be a great way to state it as well for nurses. And I can't repeat it because I forgot what you just said. I apologize. But what you said summed up everything in the benefit if you were interested in using that.
That would be up to the board. They're making the strategic plan. I'm just providing some input.
No, I thought what you said was correct too. I would just make sure, and we're wordsmithing later, but the decreased cost would definitely come at the end. All the others are more important.
Nurses on probation have adequate supervision, help nurses return to practice and decrease costs.
would we put the final statement while ensuring public protection?
Yeah.
And then the health nurses return to practice, we might want to include the intervention program in the statement as well, because that is, we don't just have enforcement with probation, but we do have intervention.
On probation and in intervention program.
Yes, the intervention program allows them to continue to work, where on probation, that's a much more difficult process. They do end up returning to work with some specific stipulations, but it's not the same as the intervention process.
Like us, okay, we're typing that up at this moment.